Have you ever wondered if your body is silently warning you of a stroke? You're not alone. 1 in 5 people who suffer a stroke had no idea they were even at risk. The scary part? Strokes can strike anyone, anytime, and when they do, every second matters. In today's video, we're uncovering the early warning signs of a stroke, the risk factors you must not ignore, and how to respond fast, because your life, or the life of someone you love, could depend on it. Before we dive in, don't forget to subscribe and tap the bell icon so you never miss our latest health videos. Part 1. What is a stroke? A stroke, also known as a brain attack, occurs when blood flow to a part of your brain is suddenly interrupted. This prevents brain cells from getting the oxygen and nutrients they need, and they begin to die, within minutes. Strokes are the 4th leading cause of death globally. But they're also one of the leading causes of disability in adults. There are 2 major types of stroke. Ischemic stroke, caused by a clot or blockage in an artery. Hemorrhagic stroke, caused by a ruptured blood vessel that leads to bleeding in the brain. Both are medical emergencies. And when it comes to strokes, timing is everything. The faster you get treatment, the better your chances of survival and recovery. Part 2. Stroke symptoms you should never ignore. Most strokes hit suddenly, and often without warning. That's why recognizing the signs is so important. Watch for these critical symptoms. Sudden numbness or weakness, especially on one side of the body. Difficulty speaking, or slurred speech. Confusion or trouble understanding. Sudden vision problems in one or both eyes. Trouble walking, dizziness, or loss of coordination. A severe headache with no known cause. Important. These symptoms may disappear after a few minutes. That could mean you experienced a transient ischemic attack, or mini stroke. But don't be fooled, this is often a warning sign that a major stroke could follow soon. Never wait it out. Act immediately. Part 3. Use the FAST test. So, how can you quickly check if someone might be having a stroke? Use the simple but powerful FAST test. F. Face. Ask them to smile. Does one side droop? A. Arms. Can they raise both arms? Or does one drift downward? S. Speech. Can they repeat a simple sentence clearly? Or is it slurred? T. Time. If you see any of these signs, call emergency services immediately. Remember, time lost is brain lost. Every minute without treatment equals more brain damage. Calling emergency help fast could make the difference between full recovery and permanent disability. Part 4. Stroke risk factors. Anyone can have a stroke, but certain conditions make you more vulnerable. Here are the biggest risk factors. High blood pressure, the #1 cause. Diabetes, high cholesterol, smoking, heart conditions, especially atrial fibrillation, AFib, obesity and lack of physical activity, excessive alcohol consumption, age, risk increases after 55, family history of stroke, migraines with aura. The good news? Most of these can be managed or reduced through lifestyle changes and proper medical care. Part 5. Stroke versus migraine, how to tell the difference. Sometimes, a stroke can be mistaken for a migraine, and vice versa. But here's how to tell them apart. Migraine auras usually come on gradually, with visual changes like flashing lights or zigzag lines. A stroke is typically sudden and intense, involving loss of function like numbness, confusion, or slurred speech. Migraines involve positive visual symptoms. Strokes involve a loss of ability, like vision, speech, or movement. Still unsure? Don't take chances. Call emergency help immediately. It's always better to be safe. Part 6. How to prevent a stroke. Now let's talk about what you can do, starting today, to lower your risk of stroke. Here are 8 proven prevention strategies. Eat a heart-healthy diet, lots of fruits, vegetables, whole grains, and healthy fats like omega-3s. Control your blood pressure. High blood pressure is the top controllable risk. Exercise. Aim for at least 30 minutes of activity most days. Quit smoking. Smoking damages blood vessels and increases clot risk. Drink in moderation. Limit alcohol to 1 drink per day for women, 2 for men. Control blood sugar, especially if you're diabetic. Treat atrial fibrillation. Don't ignore irregular heartbeats. Maintain a healthy weight. Every extra pound adds risk. Pro tip. Small, consistent changes often beat dramatic overhauls. Start with just one habit, like walking daily, and build from there. Your future self will thank you. Stroke doesn't wait. It doesn't care how busy you are. It doesn't care if you feel fine now. It just strikes, often silently, and without mercy. But now you know what to look for. You know how to respond. And most importantly, you know how to take back control. So take action today. Have you or someone you love experienced a stroke or mini-stroke? Tell us your story in the comments. Your experience might help someone else. Always consult your doctor before trying any remedies or tips shared in this video. Online content is informative, not a substitute for professional medical advice or treatment. Like this video if you found it helpful. Share it to raise awareness. It could save a life. Don't forget to subscribe and tap the bell for more powerful, life-saving health tips every week. Stay informed, stay safe, and take care of your health.